sadly often in the same individuals is they get sober from whatever. They're doing great. These are people with families. These are people that you discard your normal image of an addict and insert the most normal, typical, whatever healthy person you can imagine, because a lot of these people you wouldn't know were addicts. And then all of a sudden you get this call. So-and-so's back in jail. So-and-so's wife is going to leave him because he drank 2 bottles of wine and took a Xanax at 7 a.m., crashed his truck into a pole. It's got 2 beautiful kids. Like, how did this happen again? To the point where by the 4th and 5th time, people are just done. I mean, maybe you might be able to detect the frustration in my voice. I'm dealing with this with somebody that's like, I don't even know that I want to help this time. It's been so many times to the point where I'm starting to wonder, is this person just an addict? This is just kind of what they do and who they are. And you never want to give up on people, but, and I'm hanging in there for them, but I will say that, many people have given up on them. And so what I'd like to talk about in this context is what sorts of things help other people that we know that are addicted. What really helps, right? Not what could help, but what really helps. And are there certain people for whom it's hopeless? I mean, I don't like to hold the conversation that way, but I wouldn't be close to the real life data if I didn't ask, is it hopeless? Are there people who just will not be able to quit their substance use or their addictive behavior, despite, I have to assume, really wanting to? Yeah.
Yeah. So there are people who will die of their disease of addiction, and I think conceptualizing it as a disease is a helpful frame. There are other frames that we could use, but I do think given the brain physiologic changes that occur with sustained heavy drug use and what we know happens to the brain, it is really reasonable to think of it as a brain disease. And for me, the real window of, let's say, being able to access my compassion around people who are repeat relapsers, even when their life is so much better, when they're in recovery. Yeah, it's like a no-brainer, right? Is to conceptualize this balance and the dopamine deficit state and a balance tilted to the side of pain. And to imagine that for some people, after a month or 6 months or maybe even 6 years, their balance is still tipped to the side of pain, that on some level, that balance has lost its resilience and its ability to restore homeostasis.
It's almost like the hinge on that balance is messed up.
Exactly. And so, I mean, for someone who's never experienced addiction like yourself, maybe one way to conceptualize it is...
Well, I didn't say that.
Oh, okay.
I was not, to be clear, I was not referring to myself, but I in this example I was given, if I were, I would come clean. I would reveal that. But I think that, especially after hearing some of your lectures and descriptions of the range of things that are addictive, I think, I've been fortunate. I don't have a propensity for drugs or alcohol.
Right. Okay.
I'm lucky in that way that, frankly, if they remove all the alcohol from the planet, I'll just be relieved because no one will offer it to me anymore. Right. So don't send me any alcohol. It won't go to me.
Right.
But I don't have that. I like to think I have the compassion, but I don't have that empathy for, taking a really good situation and what from the outside looks to be throwing it in the trash.
Yeah. So, okay. So let me, and this is really, I think, important because I also had to come to an understanding of this. And I feel that I have in my 20 years of seeing these patients. And of course, addiction is a spectrum disease, right? And so you've got the severe end of things. Imagine that you had an itch somewhere on your body, okay? And it was, we've all had that, like, whatever the source. It was super, super itchy. You can go for, if you really focus, you could go for a pretty good amount of time not scratching it. But the moment you stopped focusing on not scratching it, you would scratch it. And maybe you do it while you were asleep, right? And that is what happens to people with severe addiction. That balance is essentially broken. Homeostasis does not get restored despite sustained abstinence. They're living with that constant specter of that pull. It never goes away. So let me say there are lots of people with addiction for whom that does go away, and it goes away at 4 weeks for many of them. But in severe cases, that's always there and it's lingering. And it's the moment when they're not focusing on not using, it's like a reflex. They fall back into it. It's not purposeful. It's not because they want to get high. It's not because they value using drugs more than they do their family. None of that. It's that really they cannot not do it when given the opportunity and that moment when they're not thinking about it. Does that make sense?
That's a great description. And actually in that description, I can feel a bit of empathy because the way you describe scratching an itch in your sleep.
Yeah.
You know, I've done that with mosquito bites in summer. You're scratching, and you're like, oh, you wake up scratching that mosquito bite. And I also have to admit that I've experienced not feeling like I want to pick up my phone because it's so rewarding, but just finding myself doing it.
Yes, of course.
Like, I'm not going to use this thing. I'm not going to use this thing.
Right.
And then just finding myself doing it. Like, what am I doing here?
Right.
Sort of how did I get back here again?
Right.
And I know enough about brain function to understand that we have circuits that generate deliberate behavior and we have circuits that generate reflexive behavior. And one of the goals of the nervous system is to make the deliberate stuff reflexive so you don't have to make the decision, because decision making is a very costly thing to do.
Exactly.
Decision making of any kind.
Right. Right.
So that does really help. I want to just try and weave together this this dopamine puzzle, however, because if by week, so first phase of this 30 or 40 day detox, it's like a dopamine fast.
Right.
Right. Okay. First 10 days are miserable. Middle 10 days, the clouds are out. There may be some shards of sunlight coming through. And then all of a sudden, sun starts to come out. It gets brighter and brighter. Why is it then that people will relapse, not just after getting fired from a job or their spouse leaving them, but when things are going really well?
Yes.
Is it this unconscious mechanism? Because I've seen this before, is they have a great win. I have a friend who's a really impressive creative. I don't want to reveal any more than that, but and relapsed upon getting another really terrific opportunity to create for the entire world. And I was like, how can that happen? But now I'm beginning to wonder, was it the dopamine associated with that win that opened the spigot on this dopamine system? Because it happened in a phase of a really great stretch of life.
Yeah. Right. Yeah. So you raised that great point about triggers, right? And triggers are things that make us want to go back to using our drug. And the key thing about triggers, whatever they are, is they also release a little bit of dopamine, right? So just thinking about whatever the trigger is that we associate with drug use, or just thinking about drug use, can already release this anticipatory dopamine, this little mini spike. But here's the part that I think is really fascinating. That mini spike is followed by a mini deficit state. So it goes up and then it doesn't go back down to baseline. It goes below baseline tonic levels. And that's craving, right? So that anticipation is immediately followed by wanting the drug. And it's that dopamine deficit state that drives the motivation to go and get the drug. So many people talk about dopamine is not really about pleasure, but about wanting and about motivation. And so it is that deficit state that then drives the locomotion to get it.
And earlier, your description of dopamine being involved in the desire for more, giving the sense of reward, but also movement.
Right.
I have to assume that those things are braided together in our nervous system for the specific intention of when you feel something good, then you feel the pain.
Yes.
Maybe you don't notice it. And then the next thing you know, you're pursuing more of the thing that.
And I love the way you use the word braided together. That's beautiful. And let me also just say something that I find also fascinating in my work with patients. And I see this all the time. There are people for whom bad life experiences, loss, in any form, stress in many different forms, that's a trigger. But there are absolutely people for whom the trigger is things going well. And the things going well can be like the reward of the thing is going well, but very often what it is the removal of the hypervigilant state that's required to keep their use in check. So it's this sense of, I want to celebrate, or this reward happened. I want to put more reward on there. And it's really, really fascinating because when people come to that realization about themselves, that they're most vulnerable when things are going well, that's really a valuable insight, because then they can put some, things in place or barriers in place or go to more meetings or whatever it is that they do, to protect themselves.
Along those lines, I have a friend, 40 years sober, was a severe drug and alcohol addict from a very young age, a really impressive person, does a lot of important work in the kind of at-risk youth community out in Hawaii. And he said something to me. He said, as former addicts often do, they've got these great sayings, but I think it fits very well with what you're describing. He said, no matter how far you drive, you're always the same distance from the ditch. And I said, well, that's kind of depressing. And he said, no, that's actually what gives me peace.
Yeah.
Because what would happen is, for so many years of relapsing, recovering and relapsing, he felt like it was hopeless. And then somehow conceptualizing that the vigilance can never go away, instead of making him feel burdened.
Yeah.
It made him feel relieved. So I often think about that statement, no matter how far you drive, you're always the same distance from the ditch. Because in my mind, I conceptualize that as, gosh, that's a tough way to drive down the road. But actually, on a road where you know where the ditch is and where you know where the lane lines are, it's actually a pretty nice drive. It's when you don't know where the shoulder is that you constantly have to be looking around. So there's this, we're speaking now in analogies and imagery, and science. But one of the things I find so incredible about this community of 12-step, and there are a variety of them, are the communities that they create for themselves, and some of these sayings, which I do believe link back to really core biological mechanisms.
Yes.
I do want to ask about those communities. I have a question which might be a little bit controversial.
Great.
Which is it possible that people who were addicted to drugs or alcohol or some gambling or some other behavior get addicted to the addiction community? Because one thing that I think I observe over and over is that there's some circuit in the brain of human beings that has to tell you about the dream they had the night before, for whatever reason. There's another circuit that leads people to wake you up if they themselves can't sleep. I don't know what circuit is. I'm being facetious here. But there does seem to also be a circuit in the brain of addicts to discuss and want to kind of talk about their recovery a lot. And I mention this not to poke at them, but rather the opposite, because I think that one thing that is challenging, at least for me and having friends that have a propensity for drug or alcohol addiction, not all of them, but certainly some of them, is when they're talking about their recovery, I feel like it's all they talk about. This meeting, that meeting, that meeting. How are we, so what I'm really asking here is that can we become addicted to sobriety?
Right. So this is a great question, and it links into some of the other things we've been talking about, having to do with where do we settle out? What is the way to live between pleasure and pain? And I implied earlier that ultimately we want a resilient balance that's sensitive to pleasure and pain, but that can easily restore homeostasis after we indulge, even when we indulge greatly. But the truth of the matter is that people with severe addiction, I believe, temperamentally want those extremes, and they're wired for that kind of intensity that is more than just these slight adjustments around the fulcrum, right? It's like they want the big highs and the big lows.
They'll say great meeting.
Yeah, right.
They're like, that was such an amazing meeting. Or they find a group.
Yeah.
They find a group in a location.
Yeah.
Like this is almost an inside joke in those communities. Again, I'm not talking about a friend in quotes. This isn't me reporting. Well, they'll talk about how attractive people are at a given meeting, or how bonded they feel to people at a given meeting, that the meetings themselves become their own form of dopamine hit.
Yes.
And again, I'm not being disparaging. I I want to understand this.
Right. So yes. So a lot of times patients will say to me, "Oh, I don't want to go to AA. It's a cult." And my response to that is, because it's a cult is exactly why it works. Okay.
Right.
Because yes, it is much better for you to be addicted to AA and to recovery than almost any other addiction I could think of. And we know from Rob Malenka's work, who's here at Stanford, that oxytocin, is the hormone that's involved in human pair bonding and relationships and love. And it directly links to dopamine neurons and causes the release of dopamine. So yes, when we connect with other humans, especially in a kind of transcendent spiritual way, that's a huge dopamine hit. And it does replace the dopamine that people get from drugs. And for people who have this addiction temperament, they need it on a more intense level. They're not going to be generally satisfied with kind of, a sort of acquaintanceship, right? They want that intensity of the intimacy that you get with people when you're cathartically exposing, warts and all. So yes, people can get addicted to recovery, and good for them. Go for it, and of course this can be disruptive for friendships and relationships where the one person is not in recovery. Like, you're going to so many meetings, you're always talking about recovery, but you know what? Much better than them being intoxicated, right? I mean, so although you may tire of your friends talking about their meetings all the time, I'm sure you would rather have them do that than be in their addiction. So
yeah, absolutely. And this is now the second time you've done this during this discussion, but now I have empathy because the way you describe their enthusiasm about meetings is probably the way that people feel about me and your work.
Right.
And in neuroscience, I mean, I've been getting up in front of the class since I was 8 years old and talking about things I read over the weekend. Now I just happen to have this thing called a podcast.
Right.
I've been doing it since I was little, and it annoys a lot of people. Right. I've learned to suppress it a little bit. Some people like it, but I'm poking fun at myself just to say that I now can understand that the way I feel about their reports about yet another amazing meeting, there's a different form of this, but there's some people for which they just love intense experiences.
Yes.
They're always like trying to pull me off to Bali because they're talking about how sensual it is all the time. I'm sure Bali's wonderful, but there's this kind of ratcheting up. It's like seeking Burning Man all year long. I've never been to Burning Man, no desire to go to Burning Man. But inside of academia, I mean, if I were to just turn the mirror at myself, inside of academia or here in Silicon Valley, work and the pursuit of more success, even if money is kind of divorced from that, sometimes it is, sometimes it isn't. Academic work is, for sake of pursuit of knowledge. It sounds to me like the same mechanism. In fact, it feels to me very much like the same mechanism.
So Andrew, here's what I love about you. First of all, you're willing to bring your own flaws and foibles to this conversation.
Well, they're everywhere.
Well, you know what? It's wonderful. And then you're really open and curious and wanting to understand, because I can't tell you how many people I have met who really see addiction as some kind of otherness. But the truth is, we're all wired for addiction. And if you're not addicted yet, it's right around the corner. Do you know what I mean? Mm-hmm. Especially with the incredible panoply of new drugs and behaviors that are out there. So I love that you're willing to take a moment and really try to understand this, because it is, we can all relate, and you're relating it to essentially your work addiction is right and apt. You just happen to be addicted to something that is really socially rewarded. You figured that out at an early age. Oh, when I do X, Y, and Z, all these people go, look at that smart kid, or whatever it is.
Well, for me, it made me feel safe.
Okay.
I felt like, I just felt like this, and I paused there because it's like peace. I'm like, I can relax for a moment.
When you're talking about neuroscience.
No, or just when I feel like I'm on the right path.
Yeah.
And I'm onto something, or if I see something that I'm excited about. Right. I'm like, I feel filled with, it must be dopamine. Yes. I feel flooded with pleasure, literally from head to toe. Yeah. And then my next thought is more.
So true. You're a true addict.
Okay.
You are.
Thank you.
You are,
okay.
But you just got really.
Thank you.
You really got lucky with the fact that what you're drawn to is adaptive, essentially, and then your challenge is going to be that your life doesn't get too out of balance in the sense that you're 24/7 work and you don't stop and do some other things or think of other.
And my life admittedly is somewhat asymmetric. I mean, it has other components of physical health, et cetera, but it is somewhat asymmetric. Which is why I got a dog. Although I talk about him an awful lot. So,
but the dog is good because that draws you out of yourself and a little bit away from the work. But again, I think the key here is for people who feel like they've never experienced addiction, or they don't know anybody with addiction, or if they do, they don't get it. Just think of that one thing that is the most important thing in your life that you do that gives you pleasure and meaning and purpose. And then imagine if you couldn't do it.
Oh yeah, let's not talk about that.
Right.
Well, I appreciate the feedback, and you can send me a bill at the end. What is the most ridiculous sounding addiction that you've ever witnessed that was actually a real addiction along these lines? Because I think we all know the standard heroin pill. You've been I should mention, because it's important, your previous book, and we will provide a link to that as well, focused on the opioid crisis and what we thought was medication turned out to be just as bad, if not worse, than a lot of so-called street drugs. So we understand those, gambling, sex addiction, porn addiction, now video games. We'll talk about social media a little bit more in depth, but what's the most wow, I didn't realize people could get addicted to that?
Water.
Really?
Really. So I had a very lovely patient who had a severe alcohol addiction, and she got into recovery from her alcohol addiction for many years, but she kind of had a sort of a polydipsia, or an urge to be drinking something a lot. And so she drank a lot of water, and slowly over time, she realized that if she drank enough water, she could become hyponatremic and delirious and be out of herself.
You can die from it, right?
Right, which is what she just wanted to be out of her own head. And so she would periodically intentionally overdose on water in order, to, I know it was so sad, so sad.
What happened to her?
She eventually took her own life.
Wow.
Yeah, it was really,
that's rough.
She was a lovely woman. She was so bright. She had so many interests and passions. And of course it was very sad when, when she died, but that was a wow to me. It was like, wow, if you have this disease of addiction, you can even get addicted to water.
Wow. And I think it just underscores the generalizability of these circuits.
Right.
There isn't a brain circuit for addiction to water that she happened to have. There's a brain circuit for pleasure and pain and addiction, and water plugged into that circuit.
Right.
Wow. That's intense. In your book, Dopamine Nation, you also describe some amazing paths to recovery. People that, from reading it, I won't say which ones and who, because there's some great surprises in the book too, both tragic and triumphant, as they say. You've often described your patients as your heroes.
Yeah.
Yeah. Tell us a little bit more about that.
When you think about how hard it is to give up a drug or a behavior that you're addicted to, how much courage that takes, and fortitude and discipline and stick-to-itiveness. These people are really amazing people. I mean, I don't know that I could do it, what they do, and we talked a little bit about, just the constant, ever-present urge to use, even after sustained periods of abstinence for some people. That's really, really hard. And of course, then you double down on the shame that they feel because of that urge, even when their lives are so much better. I mean, these people are really, really remarkable. And you take their remarkable accomplishment, and then you imagine the world that we live in now, where we are constantly invited and tempted and really bombarded with opportunities to become addicted at every turn.
Feeling an itch everywhere.
Oh yeah. I mean, you can't escape it. You cannot escape it, that you'll get an email in your inbox inviting you to do X, Y, or Z. And if you're addicted to that thing and, you tried to delete all your apps and not go here, all of a sudden your work inbox, you're getting those images, let's say, really, really, really hard. And yet these people find a way to do it. I think it's absolutely amazing. And they're really wise people. They have so much wisdom to offer. They've taught me a lot. You know, as I talk about in my book, I have my own addictions, and I really just like took a page right out of their book. I was like, okay, what do I do now? All right, what did this patient do? What did that? Okay.